Welcome to the Neural Implant Podcast, where we talk with the people behind the current events and breakthroughs in brain implants in an understandable way, helping bring together various fields involved in neuroprosthetics. Here is your host, Ladan.
Hello, everyone, and welcome to the Neural Implant Podcast. Today's guest is our third neuroethicist on the show. It's Hank Greely. And you may remember James Giordano and Frédéric Gilbert, who were also on, and they talked about neuroethics. I think this is a very, very interesting subject. So in this episode, we talk about some of the roles of being a neuroethicist and I guess kind of dispel some of my thoughts about like, what do they do or do they have an effect? And actually, what Dr. Greely was saying is like, they do actually, and they have a very big effect because of the committees and the actual ethical guidelines that they can make. So I thought this was really interesting. Very, very cool stuff, kind of showing the need for neuroethics and definitely to at least follow it. So Hank Greely, pleasure to have you on the show. You are the third neuroethicist on the show. Very, very excited. I've really enjoyed it because we talked to a few and it was very interesting because this is a very, I guess, contentious point of this field because, you know, you're going to be potentially in the neural implant space, you're going to be implanting stuff into the body and that could give you an advantage or there could be security aspects. And you talked at NER in San Francisco a few months ago, the Neural Engineering Conference. I don't know if that stands for NER or what, but I really enjoyed your talk. So that's why I reached out to you. So do you want to talk a little bit about your work?
I'm a law professor. I work on a lot of things around law and the biosciences. Some of them are ethics. Some of them are more straight law. Some of them are neuroscience. Some of them aren't. I'm president right now of the International Neuroethics Society. So I think I do have to confess to being a neuroethicist, whatever that is. But basically, I'm really interested in all sorts of ethical, legal, and social, and practical and political issues that arise from advances in the biosciences. One of the biosciences that is both advancing most quickly and is most central to our beings, to ourselves, to our sense of ourselves, is neuroscience. So that's what I work a lot on. I've worked on issues about using neuroscience to predict future conditions, whether it's Alzheimer's disease or, in the case of 12-year-old boys, whether it's psychopathy. I've written on issues around using neuroscience for mind reading, whether it's lie detection or pain detection or memory detection. And kind of BCI, brain-computer interfaces, can in some contexts be another form of mind reading. I've worked on issues around responsibility. If neuroscience tells us that there's no free will, does the mugger who mugged you get off because it wasn't his choice because he had no free will? I think there are really interesting issues about control. Once we can, say, change someone so he no longer hears voices when he's schizophrenic, could we change somebody so he starts hearing voices and thinks he's schizophrenic? If we can change disease states, can we change normal states, and should we? The fifth category is enhancement. I've written a fair amount about issues around cognitive enhancement. And then the sixth sort of catch-all, in a sense, is sort of research ethics. Lately, I've been doing a fair amount on what I call human brain surrogates. So things like neural organoids, human, non-human brain chimeras, and most interestingly, this made a splash last week in Nature, whole brains kept alive outside the body. The Nature paper was on pig brains, not human brains, but human brains are probably coming. So I love what I do because I get to spend time thinking about and figuring out and arguing about lots of really interesting and important things.
Yeah, I saw that paper also with the pig brain being kept alive and actually being revived to, as one colleague put it, a zombie state. And this is essentially, I think I saw a movie about this one time. Who decides if it's good or bad?
Okay, so first, on the pig experiment, I kind of go with the experimenter on this. It's not clear to me that the brain was alive, but the cells were alive. There was no EEG from the brain. There was no sign of organized brain activity. Even zombies probably have an EEG. So it was interesting, provocative. If we ever get to the point where a brain, an ex vivo brain, a brain outside the body, does have an EEG, then the science fiction movies hit big time. But to your question, who makes decisions? That was one of the things that we wrote about. I co-wrote a commentary with my colleague Nita Farahani that came out in that issue of Nature that was talking about some of the ethical consequences of this work. And one of the things we pointed out is it's not clear that anybody regulates this. There are regulations on use of laboratory animals, but A, pigs aren't laboratory animals, and B, even dead laboratory animals aren't laboratory animals. There's nobody who's necessarily has to decide whether this was ethical, whether this was potentially dangerous or painful to the pig. And that's a gap that I think we need to fill.
Interesting. And so what is your role, I guess? Do you just kind of advise, or you just kind of lay out, like, this is the framework, this is the potential pitfalls and, advantages of what we have to look out for? Or do you also like wave your wand and say like, okay, this is how it will be? Or what?
Would that I could, if I were king of the forest, but I'm not. So I basically never get a chance to say, this is how it will be. What I basically try to do is look for things that are realistic and plausible changes from advances in biosciences that I think have a very good chance of happening in the next 20 to 30 years. You get past that time frame, and I think anything is possible. But I focus on the next 20 to 30 years. So, for example, there's a fair amount of evidence that in laboratory research, you can tell with 90% accuracy whether or not a research subject is lying. That's interesting. Then I try to ask myself, so what would be the social, ethical, legal consequences of that? Could it be used in court? Would people try to use it to convince their spouse they're not cheating? Would people be able to cheat on the test? Then the third thing I typically look at is which of those consequences are going to be troubling. I don't necessarily think which are going to be ethical or unethical, but which will bother a lot of people for good reasons or bad. And then my fourth step is usually, are there ways we can get the benefits of this new science while minimizing the risks and the harms that come with it? So that's kind of the approach I take, and I write things and I give talks, and I hope that somewhere somebody is listening and paying attention. But I have no power to make anybody. I've been a teacher for a long time. I have no power to make anybody listen to me.
Yeah, what has been your experience? I mean, you've been doing this for a while. I guess you graduated with a bachelor's in 74. So you've been doing this for a while. Have you seen that like your work has been taken into account? Because I mean, a cynic might say like, oh, people are just going to follow the money. And if there's billions, millions, trillions of dollars at stake, then, like who cares what an ethicist or society thinks?
So I've been doing this sort of stuff since 1991, doing these law and bioscience kinds of questions. And there are certainly areas where nothing seems to change or make any difference. Sometimes they're economic, sometimes they aren't. Abortion fights have continued. They're deeply ethical fights. It showed no sign of resolving, and that's not really an economic fight. But say stem cell research. One of the great untold stories or unappreciated stories is almost all stem cell research, human stem cell research in the world, follows guidelines put out by the National Academies of Sciences in 2005. I wasn't on the committee that wrote the guidelines, although I did make a presentation to that committee. Those guidelines are voluntary. They do not have the force of law except in a couple of places, but most of the world, they have no force of law. They're almost universally followed because they made sense. The scientists could live with them. They gave the scientists something where they could say, if we follow this, we're okay. We can say we followed the recommended international guidelines. It gave institutions the same feeling. If all of our researchers follow these guidelines, we have some protection from being called unethical. We have some protection from bad public blowback, maybe from litigation. Sometimes the ethics does make a difference. I think, say, on the dead pig story, it is my hope that at the very least, this will lead to an extension of the jurisdiction of the oversight committees that look at laboratory animal use or animal use in research. They're known as IACUCs, which is a terrible acronym, but it stands for Institutional Animal Care and Use Committees. And they don't cover dead animals, nor do they cover agricultural animals. My hope is that what we wrote in conjunction with this very dramatic scientific finding will lead them to extend their jurisdiction to brains at least of dead animals. Now, is that going to change the world forever in important ways? Probably not. Is it going to make things a little bit better? I hope so. I'm not in the field I'm in expecting that world-changing results are going to come from my work often or ever, but it's nice to try to have some influence on the world. And occasionally, I think it works. The lie detection stuff. I've written a fair amount about the weaknesses of fMRI-based lie detection, functional magnetic resonance imaging lie detection. And there have been courts that have decided not to accept that into evidence. And some of the stuff I've written has been cited in that. And some of the people who testified in those cases are people I know and people who'd read some of my work. So you look for your successes where you can find them. No, but you should go in not with huge expectations. And of course, the higher the economic and political, the more dug in and the more partisan or parochial the economic and political issues are, the harder it is to hope to make a difference.
Wow, that is actually much better than I expect. I've always thought of a neuroethicist as kind of like, writing papers, but I don't know if people listen to it or maybe people take it into account. But I think this example with the stem cell, that is actually really interesting because I think the same applies to neural implants. I mean, it's a small field. Everybody knows each other. So if somebody steps outside those bounds of ethics that everybody's agreed on, then they could be ostracized, So then they would have to fight everything on their own. They'd have to go through everything on their own versus having the support of the community in terms of funding, in terms of whatever. So that is maybe the check. That is maybe you're kind of the traffic police of the field.
Well, so there are lots of different ways of doing bioethics and neuroethics. And some people would like to think of themselves as the police. The scientists typically think that we think of ourselves as the cops or the priests and say, you go to heaven and you go to hell. There are bioethicists and neuroethicists who think that way. Me, I'm more in the camp of saying, well, how can we do this research in a way that leads to the best outcomes and avoids some of the worst outcomes? But there are different ways of going about it. An example of the ostracism, though, there are two that I can bring up. One is quite recent. Neither is in neuro. Both are in genetics. One is He Jiankui, the Chinese scientist who CRISPRed babies. He has been widely condemned. I think his career is probably over. He may end up rotting in a Chinese prison cell. It's not a very transparent system there, so it's not clear what's going on with him. But I don't think anybody else, I think he hoped to be treated as a hero. He was not, and I think that precedent is going to make other people really reluctant to do what he did. There's an earlier example. The first person ever to do significant human gene therapy trials was a UCLA doctor named Martin Klein. UCLA's IRB refused to permit his work. So over the summer, he went to Israel and Italy and did the work. And when he came back, UCLA pointed out quite accurately that it doesn't matter where he does the work. If he's a UCLA faculty member, he needs UCLA IRB ethics approval. And his career was basically ended. Now, I think He Jiankui's experiment was reckless enough that his career should be ended. Not so sure about Marty Klein's, but it did discourage other people from cutting corners, not going through proper channels. Going through proper channels can be mind-numbingly bureaucratic, but it can also make sure that some other reasonable people look at what you're planning to do and ask hard questions and say, you should worry about that, or maybe you need to think harder about this issue or another. To come back to the implants, though, this hasn't happened yet, but I hope it will. And this is driven largely by my neuroethics colleague, the neuroscientist Helen Mayberg. Helen is one of the leaders in deep brain stimulation for depression. She's also a member of the board of directors of the International Neuroethics Society, which, by the way, everyone listening to this should join. And our annual rates are low. We're cheap, and you get a good newsletter and other opportunities. But anyway, Helen has long been speaking and fighting over the issue of when you implant somebody, what happens going off into the future? Your trial ends. Does that mean you take the implant out? Does that mean you have to keep supplying them with new batteries? Does that mean what are your obligations in the long run? And right now, there does not seem to be a consensus in the implant field about what those obligations are. Helen thinks Those are really important obligations. And I would like to see us come up with a consensus statement that would tell the community this is what's expected. Would it have force of law? Almost certainly not. Would it make a difference? I think there's a good chance it would, because a lot of the clinicians who are dealing with these people recognize them as not just research subjects, but as human beings who've got wants and needs. And if somebody's been getting good results from an implant, but your trial is over and you say you want to take it away, that's devastating to that person. So,
sorry, and then on top of that, they can't buy it anywhere else. So
right,
you can't get it back.
right. They can't replace it unless if everything goes great and Medtronic decides to go forward with it and they get FDA approval and 3 years later it's clinically available and our subject has been willing to wait for 3 years without his implant and is still healthy, sane, and alive, that's a less bad ending. But most of the time, they're never going to be able to get it anywhere else. So that's an example of the kind of thing that I think neuroethics can and should help on. But you've got lots of people doing lots of different kinds of neuroethics, ranging from wildly philosophical and science fiction-y to more nuts and bolts, like when can you turn off the implant?
Yeah, that's actually very interesting. So actually, what is maybe your opinion, or what are the pros and cons of that? I mean, I've heard about this as well. Like, do you do another surgery, which is, again, invasive, which is, again, a dangerous thing, or what do you do? So what is kind of the framework for that?
Well, so there is no agreed upon framework at this point. I think that you've got to, moving forward, act in the patient's best interests. So if the patient wants to keep the implant, the patient should be able to keep the implant. If the patient needs a new battery 7 years down the road, maybe you can figure out some way to charge them something for the battery, but you need to. Helen likes to say that once you've implanted them, you own them. And she means own in a slightly different way than usual. I think of it as once you've implanted them, they own you. You have responsibility for them. And I think that's what Helen means. You got ownership. You break it, you buy it. Once you implant them, you have really strong obligations to them and to put them first. Nobody in abstract disagrees with that, I think, but lots of people in the concrete disagree with that, because how much money is that going to take? And how many years are you talking about? Are you taking on an obligation for 50 years? Is NIH going to give you the money to fulfill that obligation? Almost certainly not. Is Medtronic going to provide it? Maybe. Is a small startup company going to provide it? Almost certainly not. So there are countervailing issues. If you make research too expensive and difficult to do, less research will be done, and that can be a problem. But I'm on Helen's side on this one. I think you've got huge moral obligations to somebody who is willing to advance your product or your career by having electrodes stuck in their brains. And you need to make sure that you do right by them.
Yeah, this reminds me of a talk that was at Society for Neuroscience last year in November 2018. Basically, the implantees of the BlackRock devices that go intracortically, they spoke, and a lot of them were talking about how much time they put into it, and like, okay, that's a 2-hour drive, they're there, and 2 hours back, and then they're there for a few hours. So it's like literally, I don't know, 20 to 40 hours per week of doing these trials, and they weren't compensated for that. So I was kind of thinking like, oh, you should be compensated. But on the other hand, that also increases the expense, meaning those trials would be less likely to happen in the future. So yeah, it's kind of a double-edged sword, kind of what you're talking about. If you have to potentially take care of this implant, like this 2-year study for 40 years, then that's kind of a limiting thing. And there might be less science being done in the end.
Right. Although you can make that argument in a lot of ways, that anything that makes something more expensive makes it less accessible, less frequent. That doesn't mean we shouldn't have minimum wage laws or that you shouldn't tip your waitress. There are some obligations there that we don't satisfy just by doing whatever is the cheapest possible thing.
Exactly. Tip your server as well is the position of this podcast.
Yeah. It's worth more to them than it usually is to you. But I do think that this is a nice example of something where somebody could get a grant or from a foundation or from a government and convene a group to say, let's come up with some solid guidelines and recommendations. And we'll have industry people, and we'll have research people, and we'll have ethics people on this group, and we'll make some recommendations. We'll put them out in the public. We'll see what happens to them. And then we may modify them based on the response, and then we'll see if we can get them adopted. That's one form of ethics, of bioethics, of neuroethics in action that I think can be really useful.
Yeah, definitely. Setting the legal framework is pretty much the most important thing you can do and will definitely shape the future in the beginning.
But I'd stress it's not just the legal framework. And in this case, it may not be the legal framework at all, just as with the National Academy's Human Embryonic Stem Cell Guidelines. That's not the legal framework. That's kind of the cultural framework, the socially accepted framework. That says this is what we as science think is right, without it having to get through a Congress that thinks anything science thinks is clearly wrong.
Yeah, for sure. So maybe more like ethical framework or like good conduct, something like that.
Best practices.
Best practices, yeah. So I'm curious what you think about like neural implants and like transhumanism, like becoming more than a human, becoming like a kind of a cyborg kind of thing. And for the listeners, just to remind them that you are in Stanford, Silicon Valley, which arguably would be the center for the beginning of this kind of stuff of actually human cyborgs. What's your opinion on this? And like you were talking about human like enhancement, and I don't know, is it ethical? And should we do it? All this kind of stuff.
So I've written a fair amount about human biological enhancement. It's one of those things that cuts across my technologies. I work on genetics and stem cells and assisted reproduction and neuroscience and anything else bright and shiny that crosses my path. But enhancement is there in all or almost all of them. I think first, people need to get a life and realize that enhancement happens all the time. I am a teacher. I get paid to enhance people, not just to give them facts, but to give them different ways of using those facts. I'm a parent. I enhanced my children, at least. Well, yes, I'm willing to say that I'm confident I enhanced them. Maybe not always, and not as much as might have been good, but they come out little barbarians, and it's your duty as a parent to try your best at least to turn them into responsible, caring adults. That's enhancement. We do enhancement all the time. I think the single most important cognitive enhancement in the history of humanity, unless you go back to speech, which we don't know much about, its origins, is written language. Written language enhanced us enormously. It gave us the ability to communicate not only across space, but across time. We can read things that were written 5,000 years ago. We don't have a lot of other ways to access thoughts from then. And here's the kicker. Learning to read changes your brain. It physically changes your brain. There's a region in the lower left, I think it's in the parietal, but it's close to the occipital lobe, that's informally called the letterbox region. Everybody who can read, and when I say everybody, put an asterisk there because brains are complicated and there's probably somebody whose brain is organized differently. But basically, everybody who can read, when they see writing, the letterbox region is activated. If you are illiterate, it isn't. If you become literate, it is. And not only is it activated when you see writing, it makes connections. It sends axons and has synapses with parts of the brain that it otherwise doesn't connect with. So you could tell if you tried, whether somebody was literate or not by looking at how some of the regions of their brains are connected. Physical changes in your brain happen when you learn to read. And really interestingly, it doesn't matter if you're reading Chinese or English or Korean or one of the Indian scripts. Any kind of reading triggers the letterbox region and changes your brain. That's enhancement. I carry a little supercomputer in my pocket called an iPhone. That enhances me. Sometimes it has some side effects I don't like, but I no longer have to try to remember what year Babe Ruth hit 60 home runs, which was 1927. If I forget it for some reason, I can look it up. I can look up a lot of things. The internet is a massive human enhancement. And I think one of the really interesting questions that nobody wants to grapple with, other than me, is there a moral difference between an internal enhancement and an external enhancement? I wear glasses. they make my vision better. I could actually make my vision better than 2020. I could have laser eye surgery to enhance my vision to beyond 2020. It sometimes can get you to like 2010, even 28. Is there a moral difference between doing it surgically and doing it with glasses? Is there a moral difference between carrying my iPhone around in my pocket and carrying it around through a chip under my dura mater in my brain? I think it's pretty hard to argue that there's a moral distinction there. So I do think there are issues with enhancement, but they apply to reading and writing and arithmetic as well as they do to brain implants. There are issues of safety, there are issues of coercion, and there are issues of fairness. And each one has its own set of interesting spin-offs. The coercion one especially, it would seem wrong if my employer said, okay, Greely, you've been slipping in the classroom. You need to get this brain implant or we're going to fire you. On the other hand, if they say, you've been slipping in the classroom, we want you to take attend this seminar on how to be a better teacher. I'd be grumpy about it, but that seems within their rights. On the third hand, something like reading and writing, an enhancement that is so valuable, not only do we allow it, although I'm sure that, in the ancient days, poets spent lifetimes memorizing the Iliad and the Odyssey so they could recite it. Just as in Islam now, many people will memorize the Quran. Those early Greek bards probably were pissed off when writing came along because it undercut their skill. I mean, people didn't have to spend 20 years learning the Odyssey by heart when they could just read it off a scroll. But with reading and writing, we not only allowed it, even though maybe the old Greek bards lobbied against it, but it's so useful that we make it mandatory. Every kid who mentally can is required to learn to read, write, and do arithmetic. That's an enhancement that we make mandatory. That's coercion. So I think these things are complicated. I think just saying, ooh, enhancement is a bad response. But on the other hand, a lot of things in life are risk-benefit calculations. If your risk is you have metastatic pancreatic cancer and you're going to die in 6 months, you're willing to, and the potential benefit is you won't, you're willing to take a lot of risks to do that. If your potential benefit is I'm going to have vision like through binoculars, but with my own eyeballs, how much risk is that worth? So I think in general, enhancements are worth less risk than medical treatments. But otherwise, I'm not convinced that there's a moral difference between them.
Yeah, I mean, I would agree. And I think it would also be determined by the profession. So, for example, 20/20 vision might not be required for what you do, but for a pilot could get fired if you don't have 20/20 vision or, have some way to augment that, like contact lenses or glasses or right. I don't know what the rules are for that.
And actually, that's an interesting one. There are piloting requirements, and there's been fighting over whether you can meet them with glasses, with contact lenses, or with laser eye surgery. I think they got lucky to some extent because laser eye surgery offered an out for most people, but not for everybody, to get to adequate vision without anything artificial. So that's an example of one place where inborn or internal is different from external, and it's better. If your eyes have been laser surgery to 20/20, then you don't have to worry about forgetting your glasses or losing your contacts. So sometimes there are pluses, sometimes there are minuses. On the other hand, it's hard to change that back where it's easy to throw away your glasses. The thing, to get back to implants for a second, though, I'm not very worried about implants, at least not in the near future, because right now, anything dramatic requires electrodes inside the brain. And that's just not a really attractive prospect. It takes a neurosurgeon. It's expensive. There's some risks involved. There's a lot of uncertainty involved. I think even in Silicon Valley, very, very few people are going to get, say, 3 Utah arrays implanted in their brains in order to be able to access the internet mentally. If and when we can start making dramatic mental changes with non-invasive technologies, particularly ones that are enhancing, then I think the mental enhancement questions will take off. But right now, as long as you've got to stick electrodes into somebody's brain, it's going to be a niche market at the very most. And the niche is mainly going to be people who are really, really sick and need it to communicate or need it to walk or need it to move their arms.
Yeah, I completely agree. It's a very, very big ask. And, nobody's going to do that to surf Twitter, 20% faster.
Right. Once we get it, and I think people are spending a lot of time and effort trying to find non-invasive ways to both record and modulate neurons. Probably somebody's going to solve that issue at some point. I don't know how, whether it's neural dust like Michelle Mahabras at Berkeley, or whether it's focused ultrasound, or whether it's much better EEG. I don't know, or transcranial direct current stimulation, which has so far been kind of disappointing. There's a lot of effort going into that. And once that becomes effective, then I think these enhancement issues become much more salient, much more immediate.
And then I would say, the floodgates would be opened, wouldn't you say? You would not be able to really stop technology that's so good. And we would have to get used to it. We would have to kind of accept this new reality in life and be like, okay, well, now people are wearing these things and they're much better, they're much sharper, like quick on their feet and everything like this. And that's just like a new norm, I guess.
Yeah, it depends on how good they are and how expensive they are, both in terms of dollars and in terms of risks and hassle and so on. I think smartphones are a wonderful example. The smartphone is only 11 years old, and there are over 1 billion of them now around the world. I can't think of anything that's been adopted so fast because it's so good, so useful. And I resisted it. I kept telling my wife, no, I'm going to keep my flip phone. I don't want to be that connected. And finally, she got me one despite my protests, and now I can't live without it.
How long has that been, actually?
3 years. Actually, yeah, it's either 2 years or 3. Not very long. I was a late adopter. My wife was in line to get the very first iPhone. She got it in the first 24 hours. So there are some differences between us. Yeah, I got my iPhone in March of 2016, so 3 years.
Wow. And you've become so normalized to it. Like it's literally a part of your body at this point. If you don't have it with you, then you have like a feeling of panic, something like that, right?
Yeah, but I don't have a panic exactly. But yeah, I get worried. I carry it with me all the time. It's done some things I like. It's also done some things I don't like. I take a lot more pictures now, which I kind of like. But what it means is when I look at a landscape, I'm no longer just appreciating the landscape. I'm thinking of the best photo shot to take. And on a hike, I could have avoided that in the past by just deciding not to bring a camera. But I'm always going to bring my phone. So the camera's always there. And I don't know whether you get this. Do you ever get phantom buzzes?
Yeah, I've turned off my vibrations. So yeah, that doesn't happen anymore. But yeah, I used to get that a lot.
Well, no, even sometimes I get it. Sometimes I've heard other people get them even when they don't have their phone on them. That your body just kind of gives off this thing and your brain interprets it as, that's my cell phone buzzing. Yeah, I'm not sure I'm keen on that. So almost everything has its pluses and minuses, including smartphones. But is there a moral difference between a smartphone and an implanted chip? They're certainly different, and there are different risks and costs and potential benefits and knowns and unknowns, and those should all factor into a decision. But is there a moral difference between them? I find it hard to see. And I should note, I also have a titanium left femur, and I just recently have plastic lenses in place of my eyeball lenses because I had cataracts. So I'm already part cyborg.
Wow. That's incredible.
Your day will come.
Yeah, I think so too. And it'll be much more extreme. So yeah, that kind of goes with my next question. We were talking about neuroethics and having advisory board, and maybe that is more adjusted or better suited for when things are smaller, like when things are, on the order of a few thousand users, like a few thousand, I don't know, stem cell scientists, something like that. But if it does get to like iPhone proportions where it's like millions or billions of people, using it, do you think advisory boards and neuroethicists will have much of a sway? Like, I guess that's what I was asking in the beginning is like, if it gets really, really big, like millions of people, could we control it? Is there a way to kind of guide it in a way that's reasonable and ethical, I guess?
Maybe. It's interesting to see if people develop standards, social standards about, say, phone use. When you talk on your phone out loud, when you only use it in earphones, when you put it on speaker mode. I don't think we're fully there, but I think habits, standards, socially acceptable times and places are developing with respect to that. Those are the sorts of things that maybe can be encouraged. But then on the other hand, you've got things where you've got laws. I'm a Californian, which means I'm really kind of a centaur. I am half human and half automobile. We have lots of laws regulating automobiles. And not only do we have laws, we also have sort of standards of what's douchey behavior and what isn't. And just how close to stopping do you have to come for it to be okay at a right turn. Things like that, or at a stop sign. So I think between legal and social things, there's some room for modulating or moderating or affecting behavior. But once something gets well established, you lose the opportunity to say, no, we're just not going to do it. Once you've got 10 million people using something, you're not going to ban it. 10 million people using it and another million people making money off those 10 million. As a matter of politics, that's just not going to go away.
Yeah, that's for sure. But yeah, I guess you are right. Like there would be kind of an emergent behavior that maybe you couldn't even predict, like, or you couldn't really be like, okay, well, what would be the standards at that point? Well, we don't know because it's literally up to the 10 million people to make a decision on what they approve and disapprove.
Ultimately, when you're talking about mass behavior, different individuals are going to make their own decisions based on the constraints and the benefits and the costs they see before them. One thing that may factor in their decision is, everybody says there's a lot of, it's like etiquette. You ask Miss Manners and she says, no, you shouldn't use your cell phone at dinner when you're out at a restaurant. Some people will continue to use it, but some people will say, that's something I should think about. And if enough people do that, you get to a tipping point where so many other people are doing it that are not doing something that the people who continue to do it begin to feel odd and out of place. But predicting social reactions is really hard. Brains are really complicated. Humans are really, really complicated. And there's 7.5 billion of us, and each one of us wants to get the world to do exactly what we want. Predicting what the outcome will be in social interactions makes the protein folding problem look easy.
That's a very funny way to put it. Yeah, very cool. So what do you think in the terms of wearables? Like that is maybe a smaller ask. Like, are there any ethical considerations with that? Wearable neurotech devices?
Are they safe? Do they work? Those are some. Are they accessible? Is it fairly distributed? If it gives you a real advantage, do other people have the same potential advantage? Are you being forced to do it? Is your employer saying, and my friend Nita Farahani's talked about this, she's got a great TED Talk on it. There are places in China that require their employees to wear an EEG cap that basically tells the employer when the employee is not paying attention, is getting drowsy, is not focused. If it's a truck driver, maybe that's a good thing that you can send them a cell phone message when it looks like they're getting drowsy. On the other hand, do I really want somebody forcing me to wear it? What happens with the data from the wearables? Who gets access to it? How well protected is it? Does your employer get all of it? Do insurers get all of it? Where does that go? So there are a lot of questions. Some of them are deep questions like coercion and consent. Some of them are more practical questions like, could an insurance company get access to this and use it to change my auto liability rates? Some auto insurance companies, I think, are experimenting with giving lower rates to people who agree to be monitored in various ways. So, yeah, wearables right now, I think wearables don't pose these questions as starkly because, frankly, they're not that good. And there's not that much of real interest or importance that they can tell us at this point. But there's something, and that'll change and become more common.
Yeah, definitely. Are there any parting words that you want to tell everybody?
Pay attention to this stuff. It is so cool. I love what I do in part because it is important. It will affect our lives, the lives of our children and grandchildren. It's also just really fascinating. Neuroscience is so complicated and so interesting. Spending a lifetime trying to understand the science would be rewarding in itself. Spending a lifetime trying to understand society is rewarding in itself. Trying to spend time understanding how the two fit together is just a blast. So whether you're an academic, whether you're an interested citizen, whether you're a scientist or an engineer, I strongly encourage you to do this, both because it's socially important, involves decisions that will be important for your life and that of others, and because it's a lot of fun.
So would you encourage them to get into the field or just read about the field?
Yes. You want to end with because it's a lot of fun.
Sounds good. Thank you so much. This has been a pleasure.
Sure, my pleasure.
Hey everyone, I hope you enjoyed that. Yeah, as you may have heard it, and you may have heard this in some of my other neuroethics discussions, I don't know, I'm maybe a bit skeptical. I'm kind of thinking like, what's the role of neuroethics actually in this field? But I think Greely was really good about showing what that is and showing that it is actually necessary because you can have such a big effect on basically the guidance of where a field might be going. And so because the field is small, kind of like in the stem cell example, because the field is so small, you can be able to control it. And if not, then you're risking being ostracized. And I thought the examples with the CRISPR baby and the guy going to Israel, I thought those were really good because it just shows how powerful this is, how important it is, essentially a peer review system on top of everything. So if you don't follow the rules, if you don't follow what everybody's agreed on, then you're going to have lots of issues. So everybody follow this. So I'm going to absolutely second Greely's advice and to follow this at the very least. Study it, maybe even become a member of this field, neuroethics, a subfield, I would say, of neural implants. So yeah. I hope you guys enjoyed this. Let me know what you think about neuroethics, if I should have more of them on. I think this is an interesting subject. I think it's very, very important because if we do it wrong, then the world will get mad at us, and that's not good.
Hope you enjoyed the show and were able to learn something new, bringing together different fields in novel ways. Until next time on the Neural Implant Podcast.